That was awesome. It is now my pleasure to introduce you to our keynote speaker for today, Dr. Aaron Michelfelder, who is a Stritch alumnus from the class of 1997. Dr. Michelfelder completed his residency in family medicine at Lutheran General Hospital in Park Ridge, Illinois. He joined the Stritch School of Medicine and Loyola University Medical Center as faculty in 2000. He later completed a fellowship in medical acupuncture and advanced training in medical hypnosis. Dr. Michelfelder currently serves as Loyola's Chair of Family Medicine, he's my boss, co-director for Loyola's Institute for Transformative Interprofessional Education, and is a professor of family medicine, bioethics and health policy, and medical education. His clinical practice includes general family medicine, along with integrative family medicine. Needless to say, he is a gifted teacher, leader, and physician. Welcome, Dr. Michelfelder.
Thank you so much. Thanks for that kind introduction, Dr. McIntyre. And I want you all to know that through the years, from being a student doctor to being the professor she is today, Dr. McIntyre has always been someone I look up to and someone who inspires me. Speaking of inspiration, Loyola class of 2024, it is you who also inspires me. To your family members, your friends, your significant others, your supporters, and even those who so doubt about whether or not you could become doctors, aren't these student doctors absolutely amazing? Let's everybody clap for them for a minute. They are just amazing, amazing people. And even if you can't hear it, class of 2024, there is a tremendous amount of cheering and clapping going on. You are amazing people. You deserve to be here. You are in the right place. And all of us are so lucky you have chosen to come to Loyola and that you have chosen to become doctors. So, what makes you so special? Is it your academic achievements, your MCAT scores, your number of volunteer experiences, or maybe it's the amount of debt you have that you cherish so lovingly? Well, maybe. There's a lot we all know about you, and those are important parts of who you are. But what makes you special has nothing to do about you and has more to do with, well, you, your sacrifices, your challenges, your failures, your successes, your moments spent crying on the shoulders of others. It's your curiosity, your yearning to grow and to learn, your openness to trying new things and to making mistakes, your innovative thinking, your social justice orientation. You're wanting to help those who are disenfranchised, underserved, oppressed, and it's your desire to help others above all else that makes you special. Loyola medical students are different than other medical students. You have enormous hearts, deep souls, and the desire and passion to change the world. So as you put on that doctor coat, it feels good. It might not fit just right, but no one will notice that. All that will show will be you in that coat, looking like the doctor that you know is inside of you. That coat gives you confidence. That coat gives you power. That coat gives you privilege. That coat gives you responsibility. That coat gives you a reminder of humility and of honor and of respect and of dignity. And as you put on that coat, it's important to remember the person wearing that coat. The person wearing that coat is human. You are human. And for us to be the best doctors we can be, we must take care of ourselves before we take care of anyone else. Yes, that's what I said. Our profession for so many years has touted how physicians must put others above all else, especially ourselves. Well, I am here to tell you that if we want to take care of others, we must start with taking care of ourselves. And then we must also take care of each other. After building strong resiliency skills and strong social connections with our colleagues, then and only then are we ready to care for others. This means a willingness to look inside. Not a quick and occasional glance inside, rather a deep and diligent dive into who we are as individuals, as partners, spouses, allies, family members, and society members. From a small boy, I have personally struggled with anxiety. My traumatic experiences as a child intensified this anxiety. Anxiety was often my friend. It helped me work hard, study tons, excel in school, and get into medical school. It served me well to help me closely follow worrisome patients to be sure I'd given them the right diagnosis and the right treatment. And all along the way, I realized that my anxiety sometimes tipped over into interfering with my dreams, my goals, my growth and development. And it wasn't until I was in my early 30s that I finally realized I needed help to be who I wanted to be. A therapist helped me for so many years, and eventually adding a psychiatrist and medications helped me build the supports I need to ensure my anxiety remains my friend rather than my enemy. You see, that doctor coat is a powerful thing. It can make you feel strong, but it can also make you feel weak, inadequate, and unworthy. I've seen statistics. Around a third of all undergrad now are in treatment for mental health issues. By the way, do you know what defines a condition versus a disorder? A condition is when you have signs or symptoms, but a disorder is when these symptoms hold you back from fully achieving your goals or interfere with realizing fulfilled relationships, or sometimes even from normal functioning on a day-to-day or moment-to-moment basis. I don't know how many of you have symptoms of anxiety, depression, ADHD, PTSD, or other mental health issues. And if the data are correct, at least 50% of you are currently struggling with issues that occasionally interfere with your realizing your dreams. Well, I'm here to tell you that mental health symptoms are not a weakness. They do not diminish you or define you. They are a calling of a different type. They call you to act. And with the help of our mental health professional colleagues, your life can be fulfilled. Loyola has an amazing cadre of supports for you. Perspectives is an entire system of mental health professionals here specifically to help you and covered through your tuition. University Ministry, our friends there who are there to listen, to support and encourage you. Your deans, your course directors, your faculty and staff, your family and friends, and most importantly, your peers. There are those of you who may not feel you have mental health issues now, and I call on you to look out for your colleagues so that you can support those who do. And if someday you have mental health issues yourselves, you'll recognize that getting help is the best thing you'll ever do. So today, do I still struggle with anxiety? Of course. Did I throw up before giving this talk? Maybe. However, I've built and continue to build my coping skills, my supports, my strength. I am a much better teacher, doctor, and person through working on my anxiety. Anxiety rarely blocks me from fulfillment anymore. Instead of being anxious, I see it from a distance. I know it's there, and instead of standing in my way, it walks alongside of me, my old friend, reminding me of where I've been and where I can go. So class of 2024, put on your doctor coat today. Feel it against your shoulders. Stand up straight and proud and confident. Put your hands in your pockets, look in the mirror and say, trust me, I'm a doctor. Laugh, enjoy. You are at such an incredible point in your career, and everyone in this ceremony loves you, is cheering for you, and knows you can do this. We are all here for you. And now be here for yourself and for each other. So sally forth and save lives. Congratulations, student doctors.